Monday Health Minutes, sponsored by Valley Health.
Hi, I'm Melanie Shafer. This is Valley Health Minutes. Colon cancer is a concern we all need to have and be thinking about. It might surprise you to know that there are 106,000 cases, new cases of colon cancer expected just this year. And even more surprising, about 20% of those will be with people who are younger than the age of 55. That's not something that may be on your radar. So we are talking to Jason Ashworth. He's a family nurse practitioner about colorectal health today. Let's talk about the guidelines first. Under the age of 55 is younger than a lot of people even think about starting to be screened for this.
Yeah, absolutely. And because of those numbers, they started looking years ago, and they actually changed the guidelines in 2018, which routinely we would start talking about and screening for colorectal cancer at age 50. And they lowered that in 2018 to 45. Of course, there are some other provisions. If there's a first-degree relative or somebody that's had a history of it, they'll do it earlier. But yeah, so those are staggering numbers.
Yeah, it is surprising, and a lot of people, you know, having a colon cancer screening and a colonoscopy is nothing anyone relishes. So a lot of people drag their feet, and from 50 to 55 can go by quickly. But again, the guidelines are moving up for sure. You mentioned family history. What other risk factors are there out there and that people need to be aware of, that they should be paying particular attention to this?
Well, there's other risk factors. Obviously, you know, family history, genetics plays a huge role in our health outcomes. But also, if there's a history in the family of, you know, polyps or precancerous polyps, lots of polyps on previous examinations of other family members, then you probably should consider maybe getting screened earlier. Some of the things that they look at, which they tried to figure out kind of a causal analysis of while they were seeing colorectal cancer younger and younger, and they really can't pinpoint any one thing, but a lot of it just boils down to lifestyle. You know, obesity is a big factor. The foods, you know, high fat, low fiber diet, being overweight are all factors that kind of play into potentially colorectal cancer.
So what's the diet that we should be watching to try to reduce this risk factor?
Well, one it's higher in fiber. That's probably one of the biggest things. Less fat. Exercise is hugely important as well. And for smokers, stop smoking is another thing that is a big influencer for development.
That's interesting. That I did not realize that. So let's talk about if you've never had a test before. Okay, what are some of the symptoms that could give you a clue that you might have a problem and you need to have it looked at soon?
Really, and this is not just for the ages of the beginning around 50 or 45, but any changes in bowel habits should probably be brought to the attention of your primary provider or someone in the medical field, because sometimes those subtle changes may mean something. In one of the studies that they looked at Yale, one of the patients that they had ended up being diagnosed with colorectal cancer just had some bright red blood in their stool. Thought it was a hemorrhoid and just treated it as a hemorrhoid, and as it turned out, it was actually one of the earlier signs of colorectal cancer.
All things we should be watching for, just paying attention. There are different tests out there. How do you determine which one is the right one for you?
Well, of course, the gold standard is the colonoscopy,
right.
Okay? But outside of that, there's just a lot of people don't feel comfortable. They've heard horror stories about having colonoscopies or just how terrible it is, taking the prep before it. Right. So there are other choices, and you could have that involve stool. So one of them is like a FIT test, and it uses an immunochemical assay to detect like blood antibodies, like kind of hidden blood in your stool. And if that comes back that it does detect it, it doesn't mean you have colorectal cancer. It just means now you need to go and get a colonoscopy. There also is another one that takes the whole stool, and it's probably you know it by the name of Cologuard, and it looks at also the DNA in the stool. It actually, if you do that and it's negative, it actually gives you about 3 years of time before you either A, need to have a colonoscopy or do another Cologuard.
Okay, so you have options.
There are options that are less invasive.
Yes, and can maybe get you prepared if you need to go to that next step. A lot of information that we need to consider to have our whole body health.
Absolutely.
Yeah, Jason, thank you so much for being
That's
here.
my
We
pleasure.
appreciate it.
Yeah, thank you.
Thanks for being here for Valley Health Minutes. We'll see you next Monday.